I'm Dr. Bert Lubin. I'm the Associate Dean for Children's Health. I've worked at Children's Hospital in Oakland for the last 46 years and was the Director of Research at this beautiful building, which used to be a high school and was a feeder school for the University of California, Berkeley. So wonderful to have this program here related to the value of food, good nutrition, on health, and on prevention of diseases by nutritional approaches.
Supervisor Wilma Chan has been a champion of children and children's health for almost her entire public life, her political career. And so for over 25 years, she has fought for programs that help families feed their children and keep their children healthy. This program was a result of a collaboration between Supervisor Chan's All-In Alameda County project and Bert Lubin, the president of Children's Hospital, who had a vision for creating a food as medicine initiative in which doctors would write food prescriptions for patients, and those patients could redeem those prescriptions just the way you would go to a pharmacy and get medication. You could go to a food pharmacy and pick up your healthy food. Our study for Food as Medicine included 60 families, identified because they have a child who has prediabetes. And participants in the study for 4 months got a weekly delivery of fresh fruits, fresh vegetables, and also whole grains. And they were supported with education in the form of classes and in the form of text messages as well about the contents of the deliveries. And we're at the point where we're learning from our experience about what are the best ways to make an intervention like this happen, because of course our goal is to be able to reach even more families and to actually be able to meet them where they need help.
What's been really exciting for me as a long-term employee of Children's Hospital was the collaboration that we put together to make this study work with the Alameda County Community Food Bank, the Alameda County Public Health Department, Dig Deep Farms, all under the auspices of All-In Alameda County. We have been very excited to participate in this study and to continue the work at Children's Hospital with our pop-up food pharmacies and our other methods of getting healthy foods to our patient population.
Public Health Department's role in this Food as Medicine initiative is to provide cooking classes for the participants. So we make available a number of cooking classes that feature the whole grains that they are receiving from the food bank and Dig Deep Farms. A lot of people have never tried whole wheat pasta or brown rice. They've heard of it, but don't try it. We teach them how to make it in a really yummy, healthy recipe. Then they're like, oh my goodness, this tastes good.
For that project, the food bank contributed really great shelf-stable, non-perishable food like whole grains and Triscuits and quinoa and brown rice and other stuff like that. We're really excited to participate in this project and projects like it because it gives us really useful information about how we can not just put out food in our community. We want to be much more than that. We want to be a public health partner, and how we can support the families that we're serving in all of their health needs that they experience in their house.
I'm from Dig Deep Farms, and we're located in San Leandro, California. Dig Deep was started in 2010. This is a nonprofit social enterprise founded on the conviction that integrated community involvement, healthy food access, and job creation raise the quality of life individually and collectively of a community.
We actually liked the lentil and kale soup, and that was actually a big hit because we didn't just share it with just us three, we shared it with my whole household. We had never eaten lentils at all, so everybody seemed to really enjoy that. And then we were given the booklet, we had the different recipes so we could cook as a family. Cooking classes were also offered for parents, and some night classes for for cooking with the children. My daughter had to talk to Dr. Tester, like writing down what she ate throughout the day. So not just the recipes, but what she ate during the previous day. It was never like, oh, you shouldn't eat that. No, it was just like trying to make those changes. Getting my daughter's numbers down, I couldn't have did that all by myself. So, having all these recipes and the opportunity to change the way we eat and how we view food, I think made a better impact on my family. When you have information, you can make those baby steps and make it into something more positive.
My family, we participates in the program, and it's just basically eating healthy. And they send healthy foods to the house, and it's great. I love it. My son loves it. I even lost a few pounds on it. And look at my son. He seems like he's happier now that he's eating more healthier instead of all that sugar. But I also find myself liking more of the brown rice now too. I kind of have brown rice like 3 times out of the week now.
At first I thought it would be nasty, but when I tried it, it was good.
Before I started eating healthy like I am now, I would go in the store and I would think that buying healthier food costs more. So that's why I used to just buy all the bad food. But now when I go in the store and I really look at it, it's not that expensive. I got my nephew and my grandson eating a little more healthier too when they're at my house. So hopefully their parents will jump on board.
My mom used to have a bad knee, and now that she's eating healthier, she can get on the floor and play with our puppy.
So I put on this apron because when I grew up, from 6 years on, I worked in my parents' fresh fruit and vegetable store, and I stood out on the street selling fresh fruits and vegetables.